Lead poisoning. In this page, I have summarized every important point related to lead poisoning, but before we get into it, we'll discuss about the pathophysiology of lead poisoning. Lead causes its toxicity mainly by affecting the heme synthesis. That too by affecting two important enzymes called LR-dehydratase and ferrochelatase. Broadly, if we see, succinyl-CoA combines with glycine in the presence of an enzyme called LR synthase to form LR, which is acted upon by LR-dehydratase enzyme to form porphobilinogen, which after many steps leads to the formation of protoporphyrin 3, which acts along with iron in the presence of ferrochelatase enzyme to form heme. Now we can see that there is a lot happening here, but what is important in case of in case of lead poisoning is this step and this step. That is LR dehydratase enzyme, which converts LR to porphobilinogen, and ferrochelatase enzyme, which converts protoporphyrin 3 in presence of iron to form heme. Here, as these two enzymes are affected, it leads to a reduction in the heme production, increase in protoporphyrin 3, an increase in iron, and increase in LR, which leads to the which explains all the clinical features that we see in case of lead. So the takeaway from this page is iron lead toxicity leads to affecting the enzyme LR dehydratase and ferrochelatase, leads to a decrease in heme, increase in RBC protoporphyrin, increase in iron, and increase in LR. Secondly, it affects the degradation of ribosomal RNA. As we all know, RBC is enucleated. It is enucleated because of the loss of ribosomal RNA. If this step is affected by lead, it could lead to a deposition of ribosomal RNA in the basophil, leading to basophilic stippling. So the second important point is lead leads to impaired degradation of ribosomal RNA, leading to its deposition, causing basophilic stippling. Now, when we talk about the clinical features of lead poisoning, the first clinical feature is the formation of lead lines. Lead lines are caused because of the deposition of lead, which could be seen in the gingiva in terms of Burtonian lines, or deposition of lead in the metaphysis of long bone. So, lead leads to lead line in the gingiva and in the metaphysis of long bone. Secondly, as we have already discussed, the impaired activity of LR dehydratase enzyme leads to increase in LR, which is neurotoxic. It is very important. LR being neurotoxic leads to encephalopathy in case of lead poisoning. Thirdly, as already mentioned, lead poisoning leads to rRNA degradation being impaired, which leads to rRNA being deposited in the base of in the RBC, causing erythrocytic basophilic stippling. Fourth, lead poisoning leads to abdominal colics. Fifth, as again discussed, ferrochelatase enzyme being affected leads to an increase in the iron, excess iron, which was not able to get converted to heme, gets deposited in the RBC, forming a ring sideroblast, which stains on Prussian blue. Thus, there is anemia because of reduced heme production and anemia because of reduced heme production, and the iron deposition leads to sideroblastic anemia. And lastly, lead poisoning also leads to wrist drop and foot drop. Now, when we talk about the treatment, lead poisoning is treated with the help of chelating agents. It could be DMSA in case of mild poisoning, EDTA in case of moderate poisoning, and BAL or dimercaprol in case of severe poisoning. Risk factors for lead poisoning include old homes with chipping paint, which could be ingested by children, or workplace hazards in case of adults. Now, in summary, lead poisoning is caused because of impaired heme synthesis, because it affects LR dehydratase enzyme, ferrochelatase enzyme. Increased LR leads to encephalopathy as it is neurotoxic. increased protoporphyrin III in the RBCs. There is reduced heme with the high iron leading to sideroblastic anemia, and impaired ribosomal RNA degradation leading to basophilic stippling. The clinical features of lead poisoning could be remembered as LEAD lead, where L denotes lead lines or Burtonian lines in the gingiva or lead lines in the metaphysis of long bone, E for encephalopathy, E for erythrocytic basophilic stippling because of ribosomal RNA deposition, A for sideroblastic anemia and abdominal colic, T for wrist drop and foot drop. So that's all about lead poisoning. This is a question regarding lead poisoning. Please drop the answers in the comment section below. Thank you.